Hi to everyone. I am Professor Thiagarajan, working in Lovely Professional University in a cardiorespiratory physiotherapy department. The last 20 years of my service, I am facing the challenges in training my students in cardiorespiratory physiotherapy. The major problem in our education system is learning only and as well as understanding about the concepts and applying into the practical exposures. So, what is cardiorespiratory physiotherapy? So, cardiorespiratory physiotherapy, which is dealing mainly involving with the patients with the heart and lung disorders, as well as people undergone for surgery and post-operative rehabilitation. Like other physiotherapy approaches, this is also a challenging one, and how we are going to identify the problems and what are the solutions for those problems and how we are going to address those problems. So, in my students, what kind of the training we are giving them to improve the knowledge in cardiorespiratory system and basic anatomy and physiology, and how they are going to apply the skills of assessment of the cardiorespiratory conditions, and the last one, the knowing about the recent advancement in cardiorespiratory physiotherapy. There are two challenges we can say. There is one thing, so driving an aircraft. So another one challenge is working in the ICU. So the both are having a different setup. Driving aircraft, there are a lot of the switches, controls and settings, wires and the pressure changes. All those things are the challenges for the pilot. Similarly, in working in ICU, so it's very challenging for all the healthcare professionals to know about where the lines are connected, how the wirings and IV lines, drug interactions, all those things are the challenges one. The one reason is the patient is unresponsive. So, to overcome these problems, so we need the patient to recover quickly. So, apart from other healthcare professionals, the physiotherapy, especially in cardiorespiratory physiotherapy, plays major role in recovering the patients faster. So, we already having many techniques applying on the cardiorespiratory patients by chest physiotherapy techniques, by vibration and manual techniques, manual hyperinflation techniques, and many techniques we are teaching the students. But at the particular moment, students always facing a problem when they learn and when they struggle with the assessment of the patients. So, when they delay in assessing some problems and they delay in progression of the patient as well. So, in this regard, so we train our students in a real-time simulation and especially ventilatory graphics analysis. We help them to analyze how to read the ventilator settings, how to observe the graphics of the ventilators, to know about the difference between restrictive problem or obstructive problems. So, the graphics are clear indicators to understand in a better way to quickly respond to the patients, so that we quickly analyze and assess the patient, so that we can stop delaying of the progress of the patients. So, this way is a recent advances which we are going to focus to analyze the graphics and understand the graphics, so that we can reduce the work of breathing, we can reduce the hospital stay of the patients, and we can reduce the loss of the oxygen support when it is really needed. The real challenges of not knowing about these ventilator settings when we experience in pandemic with the lack of oxygen and lack of the resources and knowledge healthcare professionals. Okay, so to fulfill this gap, so we train our students to reach their heights in their life, to save the mankind. The only profession in cardiorespiratory physiotherapy can help all the mankind. Thank you one and all.